Good morning, friends. Today I am going to talk about what are the things you would see if you go inside an orthopedic operation theatre. God forbid, if you have ever meet an accident or require a total hip replacement or a total knee replacement, you might have to visit an orthopedic operation theatre. So in this video, I am going to talk about things which you are going to see in the orthopedic operation theatre so that you don't feel anxious or fearful when you visit the theatre. Hi, I am Dr. Prasenjit. I am a full-time orthopedic surgeon and a part-time YouTuber. In my channel, Bone Doctor, I discuss regularly about orthopedic topics and health-related topics. If you like my channel, do subscribe to my channel. So let's start the topic. The first thing which you will notice while going inside an orthopedic theatre is that it is completely sealed, completely closed. It has no windows. It has just one door through which you will enter. Why it is sealed? Because we have to sterilize it, we have to fumigate it, we have to keep it clean for our surgery. So if there are many windows or doors or areas from where air can pass in and pass out, various bacteria and viruses can enter into the operative theatre, and thus it will cause increased incidence of infection in our surgery. Second thing which you will notice while going inside, that it has a large orthopedic table or a bed. This table is radiolucent, means it can allow X-rays to pass through it. It helps in our orthopedic surgery when we do various reductions and fracture fixations. This table can go up and down according to the height we require. It can go tilt upwards and backwards and also tilt sideways. This helps us in positioning the patient during our surgery. The next big thing which you will see inside the OT is big light, OT lights. These are big lights which are hanging from the ceiling just above the bed. These are very powerful lights and it throws very powerful rays, and thus it helps us in seeing deepest corners of the tissues during our surgery. The next important thing or the big thing which you will notice while lying down in the bed is the anesthesia machine, a machine which is beeping constantly. That is the anesthesia machine or anesthesia workstation, which is placed just on the head end of the patient. This thing consists of two parts: a monitor which is placed above the machine. It records the pulse, BP, carbon dioxide level, oxygen level, ECG of the patient, and the anesthesia machine itself. The machine pumps out oxygen, nitrous oxide, halogen, sevoflurane, and various anesthetic gases, which helps in keeping you in anesthetized condition. Next, two small things which you will see in the OT is a diathermy machine, a small box type thing that helps in stopping the bleeding while we do the surgery. It passes electricity through our body, means the patient's body, and helps in stopping the bleeding from any vessels, that is veins and arteries. And lastly, a very small machine that is called a sucker machine, which sucks in the blood and fluids in our body when we do the surgery. In the operative field, there are many times when it is filled up with blood and we cannot see anything. The sucker machine helps in sucking out the blood from that place, and thus we can see the tissues, the bones, the nerves, the blood vessels clearly. Lastly, an important machine from an orthopedic point of view, which we as orthopedic surgeons use regularly, is a C-arm machine. It is an X-ray machine which helps to give us live X-ray pictures of the patient while we perform the surgery. With the X-ray machine, we can see the pattern of the fracture, how is the bone broken, how many pieces are there, and after arranging it in a perfect way, that is reducing it as we call in medical term, we fix it with a plate or a rod, and after fixation, how does it look? This whole thing, the real-time view, is given by this C-arm machine. The C-arm machine can be used easily with our Radiolucent table, OT table, which I have discussed earlier. These are the gross things which you can see in an orthopedic OT. There are other equipments, advancements coming up lately, such as arthroscopy machine, robotic surgery machines, but those are not found in a general orthopedic OT. So next time, God forbid, if you have to visit an orthopedic OT, I think that you will not be fearful and you will know what to expect. So thanking you. If you like this video, give a thumbs up and do share with your loved ones. If you like my channel, please subscribe. So bye bye until we meet again in the next video. Thank you.